Hi everyone, welcome to Let's Talk with Mariama, your channel of motivation, inspiration and positive vibes. So it's been a long while that I did not do a sit down video, but it's October, Pink October, and I just thought, as a physiotherapist that work with breast cancer patients every single day of my career, I cannot just sit around and let this October or this month pass by without addressing this issue or sharing my role as a physiotherapist in the recovery process of breast cancer patients or breast cancer survivors. I know this is a very hard diagnosis as a woman when you get the diagnosis, when you are being diagnosed with breast cancer. But as a physiotherapist in Switzerland, I have seen the amazing different possibilities that the women have to treat breast cancer. And most women would do a yearly checkup with their gynecologist, and then most of the times that's when they actually coincidentally find out that, okay, there's a tumor or this is not something right. Maybe you want to get it checked out. The different possibilities of getting the diagnosis would be used to test maybe ultrasound or mammography or an MRI. And then when they get to a conclusion and diagnose the woman with breast cancer, then a multidisciplinary team would sit down and then evaluate the case, and you have the surgeons, the gynecologist, the nurses, the physiotherapist, the psychotherapist, nutritionist, etc. So you have a variety, a very broad range of professionals that sit to plan a treatment for the patients. And then the different varieties, the treatment possibilities that the women have are either chemotherapy, radiotherapy, hormonal therapy, surgery, etc. So the doctors actually decide what therapy is ideal for this woman from the cause of the tumor, etc. And then when they define it, they then go ahead to do the treatment. Some women have combination of surgery, chemotherapy, or surgery, radiotherapy, or hormonal therapy. So it depends on the diagnosis of the woman or the type of tumor that they have. And then as physiotherapists, then we come in a day after the operations, and then we give the women certain exercises to improve the blood circulation, to improve the mobility or the range of motion of their arm, especially the shoulder, and etc. And then 14 days after that, that would be 2 weeks after the operations, they do come again to us as physiotherapists to evaluate certain things. And so what we do, we evaluate the range of motion, that would be the mobility of the shoulder, and we also evaluate to see if there is any lymphedema, that would be like accumulation of fluid on the arm, that the arm gets swollen up, and then we also check that. We also check the stiffness or the tightness of the scar. If there is any scar tightness, then we would use certain techniques to actually try to move the scar as much as possible to make it mobile. And then also have exercises to increase the muscle power or to help them regain their muscle power of their arms again. But these are things that we do with different techniques as physiotherapists to improve, to reduce their pain, to improve their mobility of their arms, to also decrease the tightness of the scar, and then also help the proper healing of the scar. And so that it doesn't get tight. When it tightens up and then they want to move, eventually it can actually limit their movement, or it could be painful, and so on. The other important thing that we do that I find amazing, and I find it takes a lot of courage for some women to decide to do this, is the group therapy or exercising outside, the home with a group of other breast cancer survivors or patients. And in our hospital, we call it the Unco group. That is the women with breast cancer come together twice in a week. Once a week they would go for a walk of an hour, and then it is just amazing. This part is, I just fall in love with it because I see the improvement with their strength, their endurance, and so on. And the 2 times that they come in a week, one of the days they would just do muscle power training with the machines. They would also do endurance training with the bike and all that. So that is amazing. It is good, but everybody's concentrating on their work because not everybody in the group is the same. Some people are fitter than the others. Some just need more time to concentrate to get certain weights going on, and etc. And then so it is interesting to see, but my favorite part of the whole treatment is when they go out for a walk together. I am just there, you know, as a therapist, just in case of anything, but I listen a lot. I'm a very good listener, people, but when I see a woman join a group with the emotional state all the way down, and then after 2-3 weeks you see and hear them talking and discussing things with other women, it's beautiful. I love that. And also when they are on the road together, the women talk about everything, like how they feel, how they were diagnosed, when they were diagnosed, and how they reacted to it, how they dealt with it. Some got depressed, some were thankful that they actually got the diagnosis early and got their treatment, and some were just there, they don't know what is gonna happen. And so there are different emotions and different experiences, and I just walk with them and then just listen to these things that they share, and then the medications that they're taking, the side effects of the medications. And I one time had a lady said, oh, it makes me warm and sweat and so. And then the other lady was like, yeah, I had those side effects too. And then I spoke to my doctor about it, and then she changed the medications. Now it is better. And she's like, maybe you should talk to your doctor. And then the other was, yeah, maybe I should. I'm gonna do that because I do have an appointment in the next few weeks. So I found that very important. And you know, it actually helped the other one. It's not that she maybe never thought about it, but she might not have had the courage to go on and then, you know, tell the doctor what she is feeling or how she's feeling. But knowing that someone else went through it and then spoke to their doctor, and then they got their treatment adjust somehow, and that helped them, that was a vital information for her, and it was good. Every patient is different, and when some women join the group, and because you can join the group at any time. We don't wait until the first group is done to start another one. You can join in any time. And so what happens sometimes when we have new patients or women that join the group, they usually would be a bit weaker. Not always the case, but the endurance, it's usually not very optimal. What I realize in the groups, they support one another like crazy, and that is just beautiful to see. I feel they motivate one another, they bring up each other's spirits, because everyone is dealing with the situation differently. I'll tell you all the story of a particular lady who joined at some time when the others were advanced, because they would walk like for a whole hour without stopping, without having any, you know, necessity to catch their breath and all that. And then when she joined, she was slower, she needed breaks in between, she couldn't do the entire distance. And I would usually stay with her and go like, you know, tell me if you do not feel well, if you need to catch your breath or something, I will be here. I realized the first time I stopped, all the ladies stopped. Then they were there talking, you know, to one another. And then eventually the lady said to me, no, Mariama, you know, I just feel bad because the others cannot also advance. They have to wait on me. I'm slowing down the group and so on. I was like, this is a teamwork. But before I even finished talking to the lady, one of the ladies just came to us and was like, woman, we are in this together. We are not competing one another, and we would take the breaks that you need, and don't worry about it. And then the first few times, we never did the whole distance with her. But as the weeks go by, I think after the second to third, fourth week, she actually kept up, you know. And that was just amazing for her because she realized, hey, you know, I did double the distance that I did last week, and without stopping, without taking a break, without coughing, without feeling that I cannot breathe anymore. And this was just amazing for all of us in the group, and for her especially. Her level of motivation was like up there at some point. She would ride her bike 30 minutes long without stopping, and she had her breathing and respiration under control. People, I think seeing that as a therapist is beautiful, but for them to realize themselves that they are improving, they are getting there, you know, it's priceless to see that on their faces. And this is just heartwarming. Anyway, so if you all do not know what we do, this is what we do in short. As physiotherapists, we do a bit more, but then, you know, just to keep this video very short, and then tell the women that they are not alone in this, and we are all women, and at some point, who knows what would happen. But I am grateful that I got the opportunity to spend time with breast cancer survivors and then hear from their experiences, also see the way that they deal with it. I am telling you, you're very strong. There are days that, you know, the emotions are everywhere, but try to get past that. Try to get up from your bed, from your couch, and get your walks, talk to people, interact with people, and then when you're tired, get your rest. But you are not alone. And then you have so many women out there that don't know about it, but still are here for you and with you. Until next week, you have a great time, and bye.